A lot of you have been sending in a lot of questions about the vaccine, because who doesn't have a ton of questions about this right now? Cristin Severance has been trying to get some answers for us.
Yeah, Dan, this first question is so good because it shows that, the story viewers are really paying attention, not just to the vaccine, but to the numbers that the state is reporting and that we're reporting. So this viewer writes, why don't the number of vaccine doses that Oregon is receiving match up? So on Friday, you may remember, we told you that Governor Kate Brown announced 147,000 Pfizer and Moderna vaccines headed to Oregon by December 15th, and 120,000 of the second doses would arrive by December 29th. You need to get 2 shots for this vaccine to work. And some viewers wondered why the numbers were not exactly the same. So we reached out to the Oregon Health Authority. A spokesman told us the numbers are changing so quickly. They really are confident, though, that they will be allocated the same amount of the first and second doses. And if they don't get the same amount of second doses as the first, they won't give that first shot. Worst case scenario, they could move some of the first doses to the second round, but again, they believe that they'll end up with the exact same amount of second doses as the first. Again, as Dan said, all of these first vaccines will be going to healthcare workers. All right, our next viewer question, can employers force you to get the vaccine? Yes, they can. Employers can force you to get a vaccine. You can have a vaccine mandate with some exceptions. Oregon is one of 15 states that allows for philosophical and religious exemptions when it comes to vaccines. Last question, tons of interest about kids and COVID-19. What is the status of a COVID vaccine for kids? The answer here, we just don't know. Health experts, including Dr. Anthony Fauci, recently said that these vaccines will not initially be available to kids because few kids have participated in clinical trials for the vaccine. Now, children's immune systems are different from adults, and there might be some discrepancies in the vaccine's effectiveness between the 2 age groups, but we know right away that they will not be given the vaccine. Do you have a question about the COVID-19 vaccine? I'm sure you do. Let us know. Just use that hashtag, HeyDan.